Heart disease, the other one of our biggest killers. Did you know that operations do nothing to prevent heart attacks? It makes no difference from people who have an operation to who don't have an operation in terms of the number of heart attacks that they experience. Not only that, they do nothing to prevent a heart attack occurring to anyone. They're a reactive operation. So I want to share with you a study that was done by a doctor by the name of Colitis. Now, when he was sitting on the operating table, operating on different people who had heart attacks, doing bypass surgery, performing stents, he had a thought that even though he was doing lots of good work and saving lives, that he was doing nothing for the next patient that would walk into the door. So what did he do? Well, he thought about looking at how diet might change the way that heart attack patients are treated. And what he found was quite outstanding. Just going to show you a little bit of information from a study that he did. If you look at picture A, you see a very severely diseased artery. Picture B is the same artery after 32 months of plant-based treatment. As you can see, there's been a complete reversal of the heart disease. What we get commonly told is that there is no possible solution once you have heart disease. But as you can see in the two pictures attached, you can completely cure it just by changing what's on your fork. So what do both Colin Campbell and Dr. Plantbased recommend? Well, both of them will tell you that you should reduce your cholesterol to below 150. They'll both recommend to you that you eat a low-fat, plant-based diet, zero animal products. The most interesting thing about Dr. Plantbased study is that when he first initially did his experimental study, he was given the sickest of the sickest patients, because apparently there was no hope for them. I'm very happy and proud to report, especially for him, that all of those patients that continued with the dietary treatment are now symptom-free 20 years after the program initially started. Diabetes affects 225,000 New Zealanders. 50 more people every day are diagnosed with diabetes every day. It is an epidemic in this country and all around the world. We're most commonly told that there's no possible cure for diabetes. You just have to live with it. Well, I want to introduce you to someone who's been inspirational from reading his work, Dr. Neil Bernard. He has shown scientifically that you can reverse diabetes, and surprise, surprise, all on a low-fat, plant-based diet. Some of his studies have shown that for people who have type 1 diabetes, by changing to a low-fat, plant-based diet, they are able to reduce their insulin medication by 40%. And people with type 2 diabetes, he's actually shown a complete reversal of the disease. In a study of 25 patients, 24 of them were able to completely eradicate all of their diabetes medication within a matter of weeks. Well over 90% success rate, and well over any medication will ever give. Now, Neil Bernard uses a very complicated word, as most doctors do, cellular lipid. What does that mean? It basically means there's fat in your cells, extra fat in your cells. And the extra fat in your cells acts as a glue in the lock of the door of your house. Now, what happens if you get a stuck lock? Do you start walking in and out the window of your house? No, you go and fix the lock. So this is what he did. He suggested to people that if you reduce the fat intake in your diet, that you'll also remove the amount of fat that's in your cells. And what that does is it frees up the ability for insulin receptors to pass sugar from your bloodstream and into your cells. So let me just explain that a little bit better. Everyone seems to think that sugar is the main problem when it comes to diabetes. Well, it is, because you have high blood sugar. But what's actually causing that high blood sugar? Well, sugars take 3 stages from when we eat them to when they reach the cell wall. First of all, in the digestive tract. Secondly, they pass the intestinal wall and into our bloodstream. The third step is when they are transported. This is when insulin comes in. This is where they're transported from our bloodstream into our cells. Now, people who typically have a very low-fat diet, this happens in minutes. Blood sugar does not spike for more than a matter of minutes. However, people who eat a lot of fat, they get a lining in their arteries. Okay, what this does is it blocks your insulin receptors from being able to transport the sugar from your bloodstream into the cells. So it's a quite easy equation. Sugar plus fat equals high blood sugar. You cut out the fat, you cut out your high blood sugar problems. As you can see, Neil Bernard also recommends a low-fat, plant-based diet. And you'll see that this is a very recurring theme. David Klein, who helped my brother cure his colitis, recommends a low-fat, plant-based diet. Dr. Douglas Graham, who's written a very, very interesting book on the ideal calorie-nutrient ratio for a human being, the 80-10-10 diet. He says that 80% of our calories should come from carbohydrate, that only 10% as a maximum should come from protein, and that only 10% as a maximum of our calories should come from fat. So what do most of us eat? Well, the stats show that on average, each of us eat between 33 and 50% of our calories from fat. And yes, I was just as surprised as this guy when I heard this. That's a lot more than what the studies tell us we should be eating. When we think that a diet that consists of less than 10% of fat can help us reverse or prevent all of those diseases. Here are some of our more commonly eaten foods. How do they factor in when we take into account their amount of calories that come from fat? It's quite obvious that none of them get anywhere near the maximum 10% range. And that golden liquid that you see pouring out of the bottle, that's oil. That has 100% of its calories coming from fat. Oil really has no place in the human diet. You might be interested to know that the common bottle of milk that you have off the shelf is a 50% fat food. How does that work? Well, let me tell you. Let's take 100 grams of milk. As you can see on the bottle, it'll be labeled 3.25 or 3.3% fat by weight. But 100 grams of milk contains 60 calories. 88% of them, 88% of that particular food product is just water. So when we look at the 3.3 grams of fat that's in the milk, 30 calories come from fat. 30 out of 60 is 50. And that's how you get a 50% food, 50% fat food. I hope that made a bit of sense. Yes? So as we can see, all of the science tells us that by having a low-fat plant-based diet, where only a maximum of 10% of our diet or our calories come from fat, we are able to prevent and even reverse some of our biggest killers today. Just a quick recap. The ideal diet for a human being consists of an 80% minimum calories coming from carbohydrate, 10% maximum coming from protein. Now, I'm just going to quickly point out for people that think we need a lot of protein. Did you know that mother's milk only contains 6% of its calories coming from protein? If that's enough for a very small baby to grow into a small child, then why do we need any more than this? It also tells us that 10% of our calories as a maximum should be coming from fat, all on a whole foods, plant-based diet. Now, some people might call this an extreme situation. Well, this is what I consider extreme. Sitting on the operating table, having my chest cut open so that the surgeon can take an artery. Sorry, can you still hear me? So a surgeon can take an artery out of my leg and sew it onto my diseased, plaque-filled artery that's blocked and can't carry blood anymore. I'd much rather eat a banana.